Hi everyone, it is continuing for the foot health series. Today we are going to talk about I rolled my ankle, now what? I am Dr. Jeanette DeWitt with DeWitt Physical Therapy and Wellness. I am a physical therapist, an athletic trainer, and a fitness coach. And the reason I'm talking today about rolling an ankle or spraining an ankle is because so many people do this just inadvertently. You step off a curb, you step off of a step, you switch surfaces such as going from concrete to grass or grass to concrete, going to sand, running sports, athletes often will roll an ankle on a field. So rolling an ankle or spraining an ankle is such a common injury, and I just want to address what you can do about that. So the first thing that you want to do following an ankle injury is the acronym PRICE. PRICE stands for protect, rest, ice, compression, and elevation. You want to protect that joint, so it might require you to hi Steve, how are you? It might require you to protect that ankle by not putting weight on it. And that's one way you can protect it. Another way might be to use crutches or use a compression wrap, which we'll talk a little bit about here in a couple minutes. So the next part of the acronym is rest. And again, that is getting off of your ankle and allowing it to rest so it doesn't swell as much. Then we have ice. Ice is absolutely key to preventing that swelling from becoming super swollen and just creating a lot of secondary tissue injury. So when we talk about inflammation, I just want to mention that it is absolutely a normal part of the healing process for inflammation and swelling to occur. It's actually a good thing. That's your body's way of bringing nutrients to the area and getting rid of waste products. But we don't want the swelling to get out of control and then create extra stress on the surrounding tissues that aren't necessarily injured by the sprained ankle. So putting ice on within the first 5 minutes of an injury and an injury to the ankle will help control that swelling and help to control any other tissue trauma to the surrounding area. After we do ice, then we talk about compression. So this is a little bit kind of a protective mechanism as well. So you compress the area with an ACE wrap, and you start to spiral from your toes up towards your knee with an ACE bandage, and that's going to compress and apply pressure. It helps with your circulation, and it also helps with controlling swelling. And after compression, then we elevate. So you can do those last three things, ice, compression, and elevation, all at the same time by laying down, putting your foot up, and letting the ice decrease the swelling, letting the compression of the ACE bandage also decrease swelling by also maintaining good circulation, and then elevation will allow that swelling to not pull down into your foot. So that's what we immediately do when an ankle injury happens. Now, in the first 24 hours, you want to continue that PRICE acronym of protection, rest, ice, compression, and elevation. If the pain continues and you're unable to put weight on your foot, I recommend that you either go to the emergency room or an urgent care or seek immediate orthopedic consult so that you can rule out a fracture. That's really important because if you have sharp pain that's keeping you up at night, these are red flag signs that you might have a fracture, or the fact that you can't put weight on it at all and it's sharp shooting and it's keeping you awake, or what we call nocturnal pain. Those are all potential risk factors for a fracture. So you want to get that ruled out and get an x-ray. After the first 72 hours, let's say you've been cleared by an orthopedic consult or by an urgent care or emergency room, you don't have a fracture, you still want to continue that PRICE acronym of protection, rest, ice, compression, and elevation. If the pain is starting to subside in this 72-hour window, you have a couple of options. You could see if it gets better on its own, or the better recommendation is to actually seek a physical therapist who can help you along the healing process and make sure that you are not increasing your activity too soon, or that you're not doing more harm by putting more pressure on it or walking on it or attempting to run. Now, some self-treatment that you can do besides the protection, rest, ice, compression, and elevation is a layering technique with doTERRA essential oils. And I actually do this in my office, and I use the deep blue oil, I use lemongrass, I use cypress, and then I finish that with peppermint oil. This combination of layering of essential oils actually helps support the musculoskeletal system by helping with pain reduction, and basically supporting the surrounding area by giving a cooling effect and kind of supporting it in a sense of it's a soothing or relieving type of sensation. So that layering tech of doTERRA essential oils of deep blue, lemongrass, cypress, and peppermint are very helpful. That deep blue is going to provide the cooling sensation, helps relieve inflammation, joint pain, and muscle pain. The lemongrass specifically helps to refresh muscles after a workout, and it has an analgesic and an anti-inflammatory property to it. Cypress promotes energy, and it helps relieve muscle pain. And then peppermint also helps to create a cooling sensation and a stimulating effect. And it also has analgesic and anti-inflammatory properties. So that 4-pack of combination of essential oils is really beneficial, and I've seen it work on myself when I've had a significant tendonitis injury, as well as on my patients, and helping to support the inflammatory process as well as help support and decrease muscle soreness. Now, some other treatment that you can do, like I mentioned before, is physical therapy. And physical therapy is going to help with reducing your pain. It's also going to promote tissue healing. It's going to decrease your swelling through some of the modalities that we can use besides ice. We can use electrical stimulation set at different parameters to help decrease swelling and inflammation. We can also help to improve your tolerance with weight bearing. So as you're progressing from non-weight bearing, if it's a significant injury, to starting to put your foot back down, then starting to wean off the crutches, and then teaching you how to get back your normal gait or your walking pattern. These are all things that a physical therapist can do. So in that process as well, we can help you improve your balance, help you improve flexibility and strength, and then we can assist you with getting safely back to full activity. Now, a lot of people will ask me after any injury, but since we're talking about ankles, if I roll my ankle, how soon am I going to go back to my normal activity? How soon will I get back? And what I usually say is it really depends on the severity of your injury. But for the most part, tissue healing does take about 4 to 8 weeks for complete tissue healing. And if somebody has a more severe injury, it can take longer. So let's look at the grades of severity. If we look at a mild ligament sprain, so ligaments are tissues that connect bone to bone, and they create stability within the joint. And when you sprain a ligament, such as an ankle sprain or rolling of the ankle, it can be at 3 levels. The level 1 or grade 1 mild ankle sprain is going to be a stretching of that ligament. There's a little bit of stability, but a lot of times people might be able to even walk this off and continue their activity. It might not even prevent them from discontinuing or stopping what they're doing. So classic example of this is somebody steps off of a curb when they're running and they kind of roll or tweak their ankle a little bit, and then they walk on it and they're like, oh, I think it's okay, and then they keep going. Another classic example of this would be somebody's playing soccer or lacrosse on the field, and they just pivot wrong and they kind of tweak their ankle, and they come out of the game and then they test it on the sideline and then they're able to go back in. So that would be an example of a mild ankle sprain. You still want to apply some treatment to that with the rest, the ice, the compression, giving it a little bit of protection of the joint after the game or the practice, and then elevating it if it is swollen. But a lot of times activity doesn't stop with a mild grade 1 ankle sprain. A grade 2 ankle sprain is a moderate stretching of the ligament. You actually might even have some partial tearing, but it's not a full rupture of the ligament. So you do tend to have a little more swelling. There might even be some discoloration from broken blood vessels into the joint area, and then that surfaces up onto the skin. And it's going to be more painful to put weight on. This person's probably not going to go immediately back into activity, but they'll return sooner than someone who would have a grade 3 ankle sprain. So a grade 2 ankle sprain is definitely going to be within that 4 to 8 week time frame. It doesn't mean you're not playing your sport or returning to much of the activity in 4 to 8 weeks. It just means that you're going to have to take it easy for a little bit and then gradually go back in. And that's where a physical therapist can help you and guide you so that you go back safely instead of pushing too aggressively. A grade 3 is going to be a complete rupture of the ligament. And this is often going to require surgery intervention, or if it's in an area where scar tissue can kind of form back, then a person may be placed in an ankle boot to see if it starts to heal on its own. But if the joint stability is very lax or very, it's difficult to put weight on it without your ankle giving way, that's probably going to require surgery, and an orthopedic consult would definitely be warranted. With this, after any surgery, again, that healing process is at least 4 to 8 weeks, usually about 12 weeks, and it could be 4 to 9 months before you return to full activity and return to sport. And that's going to determine or be determined by the type of surgery that was performed and how many ligaments were actually influenced or impacted by the injury. Now, what happens a lot of times is people ask, when can I return to normal activity? Like, what is the criteria that allows me to go back to my normal activity? And my first comment on that is we have to respect tissue healing. So keep in mind what I said earlier about that 4 to 8 weeks. We have to respect that, because if tissues don't fully heal, then you're constantly going to have this yo-yo effect of moving 2 steps forward in your rehabilitation process and then moving a step backward. And we just, when I guide athletes, when I guide my patients after an injury, I always want them to move forward, because it's very frustrating to make progress and then regress, and then make progress and regress. It's psychologically impacting, and it's also just frustrating to physically have to keep going forward and back with fluctuating swelling, fluctuating pain, and fluctuating, oh, on this day I can do this and I can stand on it, I can walk normal, but then on the next day I can't. So we always want to move forward sequentially just to help with the tissue healing and not have any setbacks. Well, the other thing that can help with you returning to normal activity, again, is seeking a physical therapist or working with a school athletic trainer to help with the tissue healing process and help guide you back. You can actually slow down tissue healing by doing too much too soon and not allowing proper protection of the joint and injury to let it calm down. Following the prescription of your medical team will help to ensure a step-by-step process so that you are not yo-yoing back and forth. And when you are progressing in your rehabilitation and with your exercises, if you're getting pain, you need to make sure that you're communicating that with the healthcare professional, whether it's the physical therapist or whether it's the certified athletic trainer. You want to communicate that what kind of pain that you're having. If you're experiencing dull, achy soreness, a lot of that can be treatment soreness from trying something new or increasing repetitions or increasing resistance. But sharp pain and pain that shoots and pain that creates a lot of swelling into the joint, that means that was probably overdone in that particular session and you weren't quite ready for it. So we need to kind of pull the reins back a little bit and let that heal a little bit more before attempting a more aggressive exercise. When an injury occurs initially, what I want you to think about is it's actually better to sit out a couple of days and let that heal in the beginning than to press forward and push and push and push and it doesn't heal and now you're dealing with a chronic instability or a chronic painful joint. So always better to sit out and be a little more conservative the first couple of days of an injury or following an injury than to push and then be out for the entire season because you didn't let something heal from the beginning. As I mentioned, full return to activity can take anywhere from a couple of weeks if it's a mild, or 4 weeks, 4 to 8 weeks, if it's a mild sprain, or it can take up to 9 months following a severe injury that requires surgery. I hope this is helpful in teaching you a little bit more about how you can help to manage your own symptoms if you roll that ankle, you sprain an ankle, or if it's a significant injury that requires either an orthopedic consult or a physical therapist and athletic trainer intervention. If you have questions, I welcome you to write your questions into the chat, and you can also listen to this again on the replay and ask questions. I'll be checking the comments in the feed as we go along. So I appreciate you tuning in today. Thank you, Steve. Thank you, Ed, for joining. And I look forward to answering any questions that you might have. You can visit my website at www.dewittptwellness.com. You can also email me at Jeanette@dewittptwellness.com. And of course, you can give me a call at 262-842-2220. Thank you so much, and I appreciate you coming in and watching either the live version or the replay. Take care.